Good evening, and thank you for joining us for tonight's Lung Life webinar, Asthma and Exercise with Dr. Scotty Butcher. My name is Jill Hubick, and I'm a certified respiratory educator with Lung Saskatchewan. It is my absolute pleasure to be here tonight as your host and moderator. Before we begin the presentation, we would like to acknowledge that the land we are hosting this webinar on is Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux, as well as the territory of the Métis. We would like to acknowledge the many First Nations, Métis, and Inuit whose footsteps have marked these lands for generations, and we are so very grateful that we are able to host the event where we are. On behalf of Lung Saskatchewan, I also want to take a moment to acknowledge all the champions of lung health and the healthcare providers that really have gone above and beyond and continue to do so during the pandemic. Thank you so much from the bottom of our hearts and our lungs. Tonight's presentation is actually the second webinar of our Lung Life Educational Webinar Series, sponsored by GSK. Lung Saskatchewan and GSK have a long history of working together on activities that improve the lives of those living with lung disease. This new education webinar series, Lung Life, is a way to empower those living with lung disease, as well as those caring for those with lung disease, to live their best life. Just like you've joined us tonight for this webinar, we hope that you will join us for the entire Lung Life series webinar. There's 5 in total, and all of them are a way to encourage you and others to live your best life and to feel better. So here is a short video highlighting the upcoming webinars. This series would not have been possible without our great sponsors, GSK. And GSK is a science-led global healthcare company with a special purpose. Their purpose is to help people do more, feel better, and live longer. I'm so very pleased to welcome Marie-Claude from GSK to bring us greetings tonight.
Good evening, everyone. My name is Marie-Claude Desaulniers. I am the Patient Engagement Manager at GSK. Through my work, I collaborate with patient groups across Canada to understand better how we can achieve our mission at GSK, which is to help people do more, feel better, and live longer. So we're very proud to support the Lung Life webinar series, which is a very valuable tool for people living with lung disease. I thank you very much. Don't hesitate to ask any question. And thank you for wanting to know more about asthma and exercise. Back to you, Jill.
Thank you so much, Marie-Claude. Just like Lung Saskatchewan, GSK has asthma as a priority in their work. And their goal is to collaborate and support with organizations that are like-minded with the same purpose and same missions to help people feel better and live better. Lung Saskatchewan offers a variety of online support groups for patients and caregivers. Our support groups include, of course, asthma, COPD, pulmonary fibrosis, COVID-19, lung cancer, lung transplant, Saskatchewan quit switches to help people quit smoking, and sleep apnea. And our support groups are to help those living with lung disease or for those that want to quit smoking navigate their journey in a very supportive way. And tonight's topic, asthma and exercise, was actually one that was recommended and asked by our asthma support group members. So we're very pleased to host this tonight. If you're not already a Lung Saskatchewan support group member and you'd like to be, we'd love to have you. You can join us by registering for our support groups online at lungsask.ca. All right, so following this presentation, you will have an opportunity to ask your questions to Dr. Butcher. There'll be a moderated question and answer period. So if you have questions, simply type them into the question feature on the webinar software. You'll find this feature on the control panel on the right-hand side of your screen. And don't be shy and don't be hesitant to ask any questions. Chances are someone has a similar question as you. So it's now my absolute pleasure to introduce Dr. Butcher. Dr. Scotty Butcher is an associate professor in the School of Rehabilitation Science at the University of Saskatchewan and the founder of the Strength Jedi. He holds a Bachelor of Science in Physiotherapy and a Master's of Kinesiology from the University of Saskatchewan, and a PhD in exercise physiology and experimental medicine from the University of Alberta. He is certified as a registered clinical exercise physiologist and a CrossFit Level 1 trainer, and is formally certified as a certified strength and conditioning specialist. Most recently, Scotty has been certified as a mindfulness and meditation teacher, and he incorporates this in his research and daily personal practice. Scotty teaches physiology, prescription, and rehabilitation to physical therapy students and has published several peer-reviewed articles and 2 book chapters related to exercise testing and prescription. Currently training as a powerlifter, he has a passion for strength training and translates this to promoting quality exercise training and rehabilitation practices for clinicians and students. His focus in research, teaching, and clinical work is the hybrid rehabilitation strength training approach and shares his views through blogging and vlogging. So please welcome Dr. Butcher.
Hello, and thank you, Jill, very much for the introduction. I very much appreciate it, and I very much appreciate the invitation from the Lung Association. I'm Dr. Scotty Butcher, as was mentioned, and my contact information is up here on the screen. So feel free if you have any questions about the presentation or you'd like to get a hold of me after the presentation at any point in time. Feel free to email me or connect with me on social media. So as I mentioned, I would like to thank the Lung Sask for the invitation. I really appreciate being involved in their speaker series. Lung Sask has been a really important part of my career as a professor and in research, and I've got a lot of really good colleagues that have supported my work and that I feel very happy to be involved with. I would also like to thank GSK for the sponsorship and making this webinar series possible. So what I'm going to talk about today is, of course, asthma and exercise. And there's several things that I'll get into. We're going to start with some of the important factors to consider related to asthma and exercise. We'll talk about some of the exercise responses that occur with asthma. We'll talk about what guidelines are out there for exercise prescription and exercise for you as individuals in asthma, and then maybe some of the different types of exercise that you can do with asthma, and different ways that you can support your exercise habits and your exercise abilities with some alternate modes of supporting yourself. So just a quick little brief introduction here to what is asthma. And I'm going to take this directly from the Lung Association website because they've got Lung Sask has a very good definition that I really liked. And so I'm just going to read it verbatim from their site. Asthma is a chronic, which means lifetime, disease that makes your lungs very sensitive and hard, and it's hard to breathe. Asthma is not something that can be cured, but with proper treatment, people with asthma can lead normal, active lives. If you have asthma, what it means is your airways, which are your breathing passages, as shown in this graphic here, are very sensitive. Certain things can make your airways swollen, and the muscles around the airways can also become tight, and that can leave you breathless. And that's sort of the basic definition of asthma. And what we know about asthma is it does have a major impact on your airways. And so this is a slide that just shows you a little bit about what a normal airway would look like. And what we're seeing here, of course, is this is a picture of the lungs here. And then these are the airways that lead into these grape-like structures, which are called alveoli. And this is where the air goes to get your oxygen into your lungs to be able to distribute through the rest of your body. And in the normal airway, you can see that there's quite a bit of open space. When you have an asthmatic airway, or an airway that is prone to constriction and prone to potentially having infections and maybe some inflammation, you can see that the walls get very thickened. Or a lot more thickened, and the space for the air to move is actually a lot lower. So the airways will constrict and become smaller. Now, during an asthma attack, if you've ever had an asthma attack, they can be very scary. And what it basically means is that the smooth muscles around your airway that help control the size of your airways, they constrict. And you can see that the walls of the airways are a lot thicker, and the space in between for the air to go is a lot smaller. So when air goes into your lungs, usually what happens is the airways expand a little bit when your air goes into your lungs, so you can get air in usually okay. But the problem is when you go to breathe out, air can get trapped. And so you can see that in this particular graphic that air is getting trapped in the alveoli with the asthma attack. And this can lead to something that we call dynamic hyperinflation. And that can have a big impact on your exercise responses. I'm actually going to show you a little bit about that later on, about what that looks like and why that's important. Okay, my question to you, what is the #1 measure that you can take to make exercise or other activities easier? What's the biggest thing that you can do? Well, the biggest aspect and the most important aspect for you is to take control of your symptoms and try and bring your symptoms under control. And so there are certified individuals and trained individuals, healthcare providers that are part of these networks. And you see there's the Canadian Network for Respiratory Care and the RespTrek training courses, which were originated by Lung Sask, but also are Canada-wide. And they will certify respiratory educators and asthma educators to be able to provide education to you as an asthma patient, or someone who may potentially have asthma, to make sure that you have the right diagnosis, make sure that you have the right control, you're on the right medications, and you have the skills needed to keep your asthma symptoms under control. As well, your respirologist will be a big help here, and your experienced healthcare providers that have experience with working with asthma. This really is the most important aspect for you, because of course, if you are trying to exercise and you're continually having attacks of asthma where you're getting these airways spasming and constricting, and you're not controlling your symptoms, this can have a very big impact on your quality of life. So this is the first step, and it is the most important step. All right, so what does symptom control actually mean? And this is taken from the Lung Association website as well. When we're talking about symptom control for exercise specifically, One of the main recommendations that's out there is a pre-exercise use of your rescue medication. So this would be your short-acting bronchodilator that would be, say, Ventolin as an example, would provide a boost to your airway dilation. So you'd be able to start with having your airways dilated before exercise, and this can help reduce some of the symptoms and some of the problems that are associated with exercise. It is important to consider exercising only when symptoms are under control. And if your symptoms are not under control, again, this can have a big impact on your shortness of breath during exercise, or what we call dyspnea during exercise, as well as the potential safety of that exercise. So really, again, that first point is to get your symptoms under control. Reduce or eliminate other asthma triggers during exercise. So for those that have had some experience with having asthma, you know that there are certain triggers that bring on your asthma or make your asthma worse, or potentially cause an asthma attack. During exercise, we know that the length of exercise can be a trigger for exercise-related symptoms of asthma. And so if you are exercising and you know that there's a certain amount of time that that goes by that you will start having symptoms, then you might want to shorten your exercise bouts into maybe shorter, more frequent exercise. The other one is thinking about temperature. So if the temperature is too hot or too cold, potentially, either one of these can bring on symptoms and bring on and act as a trigger in different individuals. And of course, this is a highly individual type response, and some people will react to heat, some people will react to cold, and not the other one, or some people will have both as a trigger, both the heat and the cold as a trigger. A very common trigger as well is humidity, and when you combine heat and humidity, that can be a very significant negative trigger for individuals with asthma that can cause problems during exercise. So there's some really important factors to consider in terms of where you go and the type of exercise that you're going to do, and maybe when in the year you decide you're going to do inside versus outside exercise. The other one is allergens, and so trying to reduce as much as you can the allergens that potentially can be the triggers. And so these are some of the more common triggers that are associated with asthma and asthma inflammation and asthma exacerbation. Okay, getting back to the exercise guidelines, prolonged progressive warm-up and cool down is really important. So taking at least 10 minutes to warm up at a fairly low intensity to try and generate a little bit of that bronchodilation response during this warm-up so that it makes the rest of your exercise easier. And then having a cool down so that you can gradually bring yourself back down to a normal sort of resting state. And both of those can help control symptoms. If symptoms do occur during exercise, it's important to stop exercise and administer the rescue medication that you do have. So if that's an inhaler, then you would have your inhaler with you and be able to take that. If the symptoms are severe, of course, you may need to contact a health professional. It may be an emergency situation. Hopefully it doesn't get to that point, and hopefully that some of these guidelines can prevent that from happening. But always keep in mind that you need an action plan if something does happen so that you are able to access emergent care if needed. Okay, let's talk a little bit more about why asthma and exercise are related and why it's important to talk about exercise when you have asthma. Well, we exercise because we know that exercise is good for you. So exercise can keep you healthy. We know the research shows that it improves lung function, it boosts immune function, in your immune system. It also lifts your mood. So lots of physical as well as psychological benefits. And so general guidelines are to aim to be as active as you can every day. And this is a very general way of looking at things. But I want to delve into that in a little bit more detail so that you can get a sense of what that actually means. Now, this particular infographic that came from Pinterest just says, find the sport that suits you. And it certainly doesn't have to be a sport. It can be any style of physical activity that you can do. And these are just some of the suggestions that this particular infographic makes. But what we'll do is we're going to go into more of the important aspects of why exercise becomes a problem with individuals with that do have asthma. So here's my question right now is what makes you so short of breath with exercise? So when you have asthma and you have a trigger that makes things worse with your asthma, or maybe even exercise itself is the trigger where you have an exercise induced bronchoconstriction, which is that narrowing of the airways. What makes you so short of breath with exercise? So if you've had asthma and an asthma diagnosis, you've probably done spirometry, or at least you've been shown maybe how to use a flow meter, expired flow meter. I'm going to show you just over a few slides here a little bit about spirometry, and it's not important that you fully understand all these graphs. So if you have difficulty understanding the graphs, don't worry about that. You'll still get some good information with this. But if you have done spirometry and seen these before, maybe you have some questions about what they actually mean. So what I'm going to do is I'm going to take you through a little bit about what this spirometry looks like, what a flow volume looks like, and that'll help explain a little bit about why shortness of breath is such a problem during exercise and what's really going on with your lungs. And so what we have here is we have a flow volume graph, where on the y-axis here we have your flow rates. And so flow rates are the speed of air going in and out of your mouth. And so the higher the speed on expiration, you'd see the curve go really high up this way. The higher the speed or the flow rates on inspiration, you'd see the curve go down this way. Now, the volume will also change as we breathe in and out. And so this is a volume graph. The top of your lungs is over here on this side. So when your lungs are completely full, that's over on the left-hand side. And when your lungs are empty, that's on the right-hand side. So let's have a look at what this looks like with normal breathing. So if I were to take a resting breath in, so you just as you're sitting there, you can think about the breath that you're taking in, you would have a certain amount of speed that comes to that breath. So you would breathe in and you'd have some speed and you have a certain amount of volume. Okay, let's look at that again. So there's a breath inwards moving up to fill your lungs a little bit. Okay, you'd also breathe out again. And that breathing out process is typically very passive. You don't have to think about breathing out. You can just relax and your breath comes out again. And so if we're sitting at rest, this would just happen with every breath. We go in and out like that. When we do the spirometry maneuver, that is one of the maneuvers to help you diagnose your asthma, we are going to do what's called a maximum flow volume loop. And so you'll have that mouthpiece in. If you're familiar with doing this, you'll have a mouthpiece in, probably some nose clips on, and you'll be breathing through a tube, and that tube is going to measure this change in flow and volume. And so if you've done this before, you'll be familiar with this, but I'm just going to walk you through what this looks like. So they're going to ask you to breathe normally, normal breath in, normal breath out. Then what they'll do is they'll ask you to take a really deep, big breath in to fill your lungs completely, and that's called an expiratory capacity. So the lungs get full completely all the way up until total lung capacity or where they're completely full. Then what they're going to ask you to do is to blast your air out as fast and as hard as you can. And you're going to find it super easy to get that air out at the very, very beginning of that blasting breath, but then it gets a lot harder. And you're going to see what that means when we look at what happens and what changes with the flow rates. So on inspiration, you've got a pretty freely flowing inspiration. It's pretty, pretty curvature, good curvature, and in terms of what you're seeing, and it looks fairly normal and what we would expect to see. When you do that blasting breath out, this is what it looks like. Blasting hard, fast breath out, and then it slows down as you go, and it's not circular. You don't have that nice curve to it. You have a really fast increase in your flow rates followed by a dropping of your flow rates. And that's just a normal response of your lungs to the airways getting smaller as you breathe your air out. And then they would ask you to finish with another breath in. And this is your maximum flow volume curve. So this is the maximum inspiration, maximum expiration. And really what this curve is saying, there's a few things that we can look at when we look at this, is it saying, well, this is sort of the maximum capacity for your lungs to be able to breathe quickly at any given lung volume. So if you were at your normal breathing volume where you're just sitting and breathing at rest and you tried to blast your air out, you couldn't blast your air out any faster really than what's seen here. You might have just a little bit there, but you wouldn't ever be up here, right? So we have this decrease here. So when we're exercising, what you're going to see is that we only have a certain amount of range that we can actually work within. So that range is a really important aspect to look at. And so we're going to spend a bit of time looking here. The other thing, just from an asthma perspective, if you've ever been shown how to use an expiratory peak flow meter, what they're talking about is this point right here. It's the peak expiratory flow. So it's how fast and hard you can get that initial breath out, and that'll measure these flow rates rather than the whole curve. It just measures the maximum flow rate. And this is a really good sensitive indicator of your asthma control. Is if this changes quite a bit, it means that your symptoms aren't under control as much as they should be. Okay. Now let's have a look at this. So normally during exercise, this is the same curve. This is again your resting breath, and we have these values here called end expiratory lung volume and end inspiratory lung volume. That's really just the where your overall resting breath. That at the end of expiration you're here. At the end of inspiration you're here. Now, during exercise, we know that exercise increases your breathing, and that's normal, and that's what we want to see. So it's normal to breathe heavy during exercise. And what happens is not only do we increase the speed of breathing, but we also increase the depth of breathing. And so we actually decrease our end expiratory lung volume. In other words, we breathe out more, and we increase our end inspiratory lung volume where we're breathing in more. And so the total amount of volume going in and out of our lungs is a lot higher, but we also do that more quickly. So we do that at a faster flow rate, which also increases our respiratory rate, or the number of breaths per minute. Now, this would be just mild exercise where we see little increases, but as exercise gets harder, we need more breathing because we're trying to get oxygen into our system and carbon dioxide out. So the breathing gets heavier and heavier. And so with heavier exercise, you'll see the same pattern, an increase in the volume as well as an increase in the speed. And then maximum exercise in someone who doesn't have asthma would look something like this, where we see a really nice decrease in the amount that we breathed out. So we push that lung volume down and we can breathe in, and there's lots of room to move. If you have a look at the maximum rate or the maximum speed at end exercise, it's not anywhere near our maximum envelope that we did at rest. And so there's still lots of room to move here. And that's the way to look at that. But what we can see is there is a point here where if you were to either breathe a little bit more, or your lungs maybe didn't have the capacity that they do shown in the green line, there may be a limitation here. There may be a problem because this white line is getting pretty close to the green. Now, I'm going to explain why this is important. This is an analogy that I really like to use. So I go to Regina for Rider games. I was actually there not for a Rider game the weekend prior to this broadcast, but I was there for a dance competition. So we'll call it that, but I'll go down to Regina for the Rider games. And of course, what we know about traveling to Regina for the Rider games, if you're traveling around the speed limit, it'll take you just a little bit more than 2 hours to get down to Regina, traveling the path from Saskatoon, where I'm based out of the University of Saskatchewan. And so if I know that it's going to take me just over 2 hours, I might leave if kickoff's at 7 o'clock, I might leave a little bit before 5 o'clock to get there in time for kickoff. So let's look at what that would look like. And trust me, there's a reason I'm getting into this, okay? So here's the path from Saskatoon to Regina on a similar graph to what I've just shown you. So let's start off and let's say we're being a little bit, not aggressive, but let's call it 120, which is just a little bit over the speed limit, but that would get you there right at 2 hours. So normally traveling from Saskatoon to Regina at 120 kilometers per hour, if we were able to maintain that, we would get there in time for kickoff. We leave around 5, get there for a 7 o'clock kickoff. We've got 2 hours to get there, no problem at all. But if you're from Saskatchewan, you know exactly what I'm about to talk about. What do you hit partway through your trip? Well, you hit construction. Okay, so construction in Saskatchewan means that you are dropping down to 60 kilometers per hour. So we've got a bit of a problem here. If we're a significant portion of the trip, instead of going 120, we're going 60, we're not going to make it in time for the kickoff. So we have a couple options. One is to turn around and go back to Saskatoon, where we would stop our path, and we would actually turn around and go back to the beginning. Or what's more likely is that we'll say, oh, darn it, we're going to be late for kickoff. We continue on towards Regina at this lower pace, and eventually we'll get there, but we're going to get there late. Okay, so this is really what ends up happening. And you can look at the shape of this curve. If this is speed and this is distance or potentially volume, this is very similar to the curve that we see here. Okay, so that's what this maximum flow volume curve looks like and why it becomes limited. Now, if we look at the normal situation, during exercise, we're getting close to this limitation here, but we don't actually see a limitation until, again, either we breathe heavier because we're fitter, or we have a reason, or something means that we're breathing heavier, or our lung capacity is reduced. So when capacity is exceeded by demand of breathing, what ends up happening is we see this limitation. This is the construction. So if this is Saskatoon, we go to 120, oh, we hit construction down to 60. It's going to take us longer to breathe out or longer to get to Regina, or we turn around quicker. And that's what actually ends up happening during exercise. Because if you can imagine, if you're struggling to breathe out during exercise, you're struggling to breathe out. Like someone said, well, now you have to breathe out through a straw and you have to take twice as long to breathe out. Most people would have difficulty doing that if exercise is already difficult and if you're already feeling short of breath. So instead of taking longer to get down to these lower lung volumes or to get all the way down to Regina, we decide to say, uh-oh, we're not going to make it in time for kickoff. Let's turn around and go back and stop in Davidson and watch the game from Davidson, or go back to Saskatoon and watch the rest of the game from home. This is what happens with exercises. We stop breathing out and then we breathe in sooner. We return back to our breathing in. But the problem is if we haven't reduced our lung volumes, we still need the same amount of volume because we're trying to get oxygen in and carbon dioxide out. So what happens is that air traps. The air traps in the alveoli, and we start pushing our breathing up towards the point where our lungs are really, really full. And this becomes a big problem. We call this an expiratory flow limitation, and this is very, very common in individuals with asthma, particularly if their asthma is uncontrolled or if they have a chronic nature or a chronic aspect to their asthma. So why is this such a big problem? Well, one is what we call, what I just described, a mechanical constraint on volume expansion. That just means that you're trying to take more of a breath in, but because you've already filled your lungs because of this dynamic hyperinflation and the expiratory flow limitation, you've breathed all the way at the top of your lungs. You can't expand your lungs anymore. So that's going to be a problem because you're not going to have the amount of ventilation you need to meet the demands of exercise. The second part is that the effort of breathing, or what we call the work of breathing, is going to be significantly higher. And if you want to know what this feels like, the best way to do this is just to take a second. Let's all do this together right now. Take a second to just breathe normally and just feel your breathing. So you're just sitting here listening to me talk, and you're feeling the breathing going in and out. You're feeling the amount of effort that it takes to breathe in and the amount of effort it takes to breathe out. Also feel how deep you're breathing, like how much air is coming in. Just see if you can feel that. Just take a couple breaths and feel the sensations of breathing. So when I tell you to, what I want you to do is continue with your breathing. Take a big, not yet, but take a deep breath in, fill your lungs completely, and then I want you to try and breathe with that same volume. So it's going to look like this. So you're breathing up at the top of your lungs. You're still trying to move the same amount of air, but your lungs are completely full. Do that for 2 or 3 breaths and then relax. And then just take a second to let yourself recover and get back to your normal breathing, which was harder. It was definitely harder for you to breathe at the top of your lungs when your lungs were completely full. And that's what we call an increased work of breathing. So even though with individuals with asthma, often it's the breath out that's the problem that causes the expiratory flow limitation, you might feel it more on the inspiration, and then it's harder to take a breath in and expand those lungs because of the increased work of breathing. Okay, So what happens in terms of asthma? And so in these situations, what I'm talking about here is the flow volume loop in a situation where your asthma isn't controlled, where you do have a reduction in your airway size, which reduces the speed. It's like I said before, taking your airways, and instead of breathing through your normal airways, you now have to breathe through a small straw. It's going to be very difficult to breathe that air out. In that situation, or in the case of a chronic asthma that's been present for a very long period of time and maybe wasn't fully controlled, and you've developed a chronic aspect that isn't fully reversible with bronchodilators or other types of medication, you're going to see reduction in this maximum flow volume loop with this telltale inward curve. And this inward curve is something that happens with many chronic diseases that affect the airways, including asthma and emphysema and chronic bronchitis and COPD. And so what we see is these peak flows are reduced compared to what we saw in the green line. And instead of a straight line, we also see an inward curve that again is characteristic of having a problem with the expiration. Okay, so what does this exercise look like? So here's our end expiratory lung volume, our end inspiratory lung volume, and as we start exercising, what you can see is that if we have a fairly severe reduction, this expiratory flow limitation, or this hitting constriction on the way to Regina, happens very, very early. And so we're going to start stacking our breaths, and air becomes trapped fairly early during exercise. And eventually, in the individuals with a fairly severe response, you see something that looks like this if we were to actually track this during exercise. And this is a test that can actually be done if you talk to your healthcare provider, your respiratory healthcare provider, or your respirologist. You can get these exercise tests done to determine if this actually happens for you. As you can see here, this is that tidal volume constraint because of dynamic hyperinflation, and it also restricts the flow rates. So that's fairly typical. Now, in the controlled situation, you might think, okay, well, if my asthma symptoms are controlled, then I should be good to go. Now, that is, again, the most important step. So it is very important for you to consider the control of your asthma and having that as your first step. And so what we're looking at here is we're looking at a study that basically showed that type of response. But what we see is that individuals exhibit a couple different responses when their asthma is controlled. So this one on the right-hand side is a situation where with your controlled asthma, what happens is during exercise, you actually can increase and relax that smooth muscle and relax the airways. So the airways can dilate a bit, and they can actually get a little bit bigger. And so if your situation's controlled and you're exercising, you can actually see that your exercise loops here go over and above the loops that we would see at rest. And so you can actually get a little bit more air in and out. And so if you're able to get more air out, right, it's not constriction you hit, but maybe instead of dropping down to 60, maybe it's only 80 or 100 that you have to drop down to, which for whatever situation that is. You're able to maintain your airways and your lungs in a normal position, a normal amount of volume, that you're not having that increase in that work of breathing or that effort of breathing. So in this situation, this is what we're ideally striving for with asthma control. One of the things, though, that we do see that there are individuals, even when their asthma symptoms are controlled, that still exhibit this expiratory flow limitation and have some degree of dynamic hyperinflation. So even with controlled asthma, these responses can also still happen. So you may find that even when your asthma symptoms are controlled, that there may be still some difficulty with that breathing out, and you may still have some of these symptoms. And that's important to understand. And again, you can have some testing done to see if this is the case for you. Well, what are the differences here? So if you have symptoms that continue with exercise, this is again, as we talked about, an expiratory flow limitation, a mechanical limitation on breathing or ventilation, and it's restricted exercise ventilation. So it'll actually reduce your top end. So you would have an inability to increase your ventilation with really, really high levels of exercise. It makes it much harder to breathe. With this one, where the symptoms are controlled and you're able to perform exercise a little bit better, the expiratory flow limitation is still present, Because you have bronchodilation, it doesn't cause a mechanical limitation or a limitation on your breathing volume, and your ventilation can be normal. But despite these normal responses, they still occur at a lower intensity. And so the ventilation still tends to be a little bit higher than in individuals that don't have asthma. And it's still higher than normal breathing resistance. And so even with controlled asthma, we do see some lingering effects. And so what I'm going to talk about for the remainder of the presentation is a little bit on what the guidelines are for how to address exercise with asthma, given that we know what's happening, whether your asthma symptoms are controlled or not, and even when they're controlled, if you're having some issues. But then we'll also talk about some supplementary activities you can do to try and make things a bit easier. So one really good reference here is from asthma.ca. So this is the Asthma Society of Canada. This guideline was put out. It's called Breathe Easy, and it's a very, very good guideline. You can find it at their website, and I do have the link at the end of this presentation to this, a guide for being active when healthy with asthma, and it's a very good resource for you to go to. And so a lot of this information I've taken from here, as well as some of the other guidelines that are out there. Let's talk a little bit of history before we get into that. And I think this is a very wise individual from 1882, a physician that he talked about individuals with asthma and seen, so his quote is saying that he's seen several cases in which prolonged bodily exertion or exercise or activity has been of great benefit, indeed some of which has been the best remedy to which the asthmatic could resort. And so this was obviously many years ago, and I'll be honest, the guidelines have not changed that much from these particular guidelines from back then. The remainder of this quote was, of all the remedies, there is none so complete and lasting as a day of severe walking exercise, 5 and 20 miles. The strain must never be great. Increase the pace only when it is pleasanter to do so than not. And I think that this is a really important message, to try and stay as active as you can. And it doesn't have to be something that is really aggressive exercise that is unpleasant. This could be something that is simply going for walks, or something that's very light and easy. But this repetitive nature of being active is very important. And so most of the guidelines that are out there now recommend this as a minimum. Try to get 20 to 30 minutes of enjoyable physical activity 3 to 5 times a week. And this is certainly at a very minimum that you should be trying to do this. If you can do more, you'll get more benefit. More doesn't need to be harder. More just usually means either more times a week, or maybe try and go for a little bit longer if you can. But be careful, again, watching for symptoms. And so if your symptoms happen with longer durations, you'll be way better off with keeping the durations to relatively short, into this 20 to 30 minute time frame, and trying to increase the number of times a week that you're exercising. So what do we know? Can exercise improve asthma? Well, here's some of this typical benefits of exercise and regular exercise. We know that in patients with asthma, it will increase cardiovascular fitness, endurance performance. If you're talking about trying to go for a 5K race or something along those lines, it will improve your fitness and your performance. Exercise, similarly to those in people without asthma, it reduces your risks of many other diseases, including diabetes and cardiovascular disease. And it also helps people with asthma keep active, keep participating in their normal activities, keeps a regular, relatively normal emotional status, and maintains quality of life. So exercise is very important from those aspects. But does it actually have an impact on asthma itself? Well, there is some evidence that suggests that. So what the research will show is that regular exercise will reduce your medication risk, reduce the amount of ER visits, or the absenteeism from school or work. It reduces the intensity of any asthma attacks that you would have. It reduces the ventilation and the heart rate during exercise, which can help keep you away from those ventilatory limitations and hitting the construction during exercise. It increases your breathing efficiency, which is also very important for keeping your breathing levels down and being able to get more oxygen into your system, and without that increase in work. It can increase your pulmonary function. So that spirometry test that you would get to help you diagnose or help your physician diagnose asthma, is that some of these aspects can be improved, and they're the ones related to the airflow limitation. And so you'll see values like your FEV1 or your forced expiratory volume in 1 second, which is one of the primary markers of airway obstruction that your doctor will talk about, or your certified asthma or respiratory professional will talk about. And that can actually improve with exercise. The other thing it'll do is it'll reduce your peak flow variability in certain situations. And so if your asthma is relatively uncontrolled, this would, again, as I mentioned before, that peak flow will go up and down a little bit as you have more triggers or less triggers. And exercise can actually help reduce that variability and keep your peak flows relatively stable in certain individuals. It can also increase the number of symptom-free days of your asthma symptoms. So lots of asthma-specific benefits associated with exercise. What we do know, though, is it doesn't do everything. It doesn't change the markers of airway or lung inflammation that are associated with asthma. So you still have certain issues that'll be present. And as I mentioned, we see a lot of these issues happen in certain individuals, even when their asthma is controlled. Exercise won't change that. The other thing is it doesn't seem to have a big impact on the overall hyperreactivity of your airways, your what we call bronchial hyperreactivity. So again, it can have an impact on your symptoms and change a bit on your lung function, but that hyperreactivity might always be present. And it certainly isn't going to be exercise that's going to do everything. This is where you do need your medication as part of this. It won't change your total capacity of your lungs. So you won't see exercise changing your what we call vital capacity, or that total amount of volume that can go in and out of your lungs, nor will it change the amount of air that's left over after you do a full breath out. We always have a little bit of air left over, and with patients with asthma can have a little bit higher, and exercise won't do that. There's variable evidence about the long-term symptom control of exercise only, and the effect on pulmonary function. Again, it happens with some people get better quicker with exercise, some people don't at all. Again, this is where that symptom control is very, very important. Lots of different positive functional outcomes that happen with this, as we've seen. So I'm not saying don't exercise, because it's not going to help you fully. What I'm saying is it's important to maintain your asthma control and really do your best to get your asthma symptoms under control, and also add in an exercise or a physical activity program. So other ways of helping you exercise. If you're meeting the generalized guidelines of trying to get as much activity as you can throughout your week, there are some ways that you can support your exercise efforts to help you not only reduce your symptoms, but also help your abilities to exercise. One of the most valid ways that we've seen is inspiratory muscle training. And this is just where you breathe in particularly through a resistance. And there are several different types of resistance meters out there that you can buy or that you can have access to that will help you provide this resistance or inspiration. So it's basically like doing a bicep curl for your respiratory muscles. Instead of just, for trying to build your bicep muscles, you're trying to build your respiratory muscles. And so the evidence has shown that we reduce shortness of breath during exercise, as well as increasing your breathing efficiency after doing some inspiratory muscle training. Some of the devices out there that have been shown to be effective are the Power Breathe. There's a breather, something called an air physio, and there's lots of other examples out there of different devices you can use. Another way that has been shown very interestingly to look at how you can improve your symptoms of asthma, not only at rest but during exercise, is mindfulness and mindfulness-based approaches, where we're looking at different types of breathing techniques. And so mindfulness in and of itself, if you've never heard of this, is really it's just paying attention to your body and your body's signals and really thinking about what are these signals and what is happening right at that present moment. And so what does it feel like to breathe? What does it feel like to breathe with exercise? You can reduce your symptoms of anxiety if you have anxiety associated with your symptoms of breathlessness or shortness of breath, but you can also tune in a little bit to your body's own efficiencies. And so we've seen actually that mindfulness-based approaches can actually enhance your efficiency of breathing and make it easier for you to breathe. And what's important about this is it's not just the paying attention, but you're sitting and doing it on purpose. And so I don't mean sitting necessarily. When I say sitting, it could be while you're walking, it could be while you're exercising, or while you're doing a formal meditation practice like this individual is. When you're doing that, you're not trying to change. And that's one of the important aspects of mindfulness, is that you're not striving to reduce your symptoms, you're just simply noticing and really letting your body do its best effort to try and relearn efficiencies and relearn the normal sensations of breathing. And that can really help with your symptoms, as well as your if you have any excessive ventilation associated with any of your symptoms or with exercise. The next thing that has been shown to be very helpful is diaphragmatic breathing. And so this is the example where what you're doing is you're looking at different breathing muscles. And we know that we have breathing muscles associated with different aspects of where we breathe. And so if we really think about doing a chest breath, where she's got her hand on her chest and we're really trying to expand the rib cage and sort of almost think about breathing upwards, this is what we call more apical breathing, or breathing using our accessory muscles of breathing. This is a very inefficient way of breathing, but it's something that tends to be necessary if you're very short of breath. But what we know is if you can access what we call the diaphragm, which is the main inspiratory muscle, which really is at the bottom of your lungs, and if you really think about pushing your diaphragm down by having the hand that's on her belly here would be pushing outwards. So what she's doing is she's trying to have her diaphragm do the most of the work. And the reason that that's important is that your diaphragm is the most efficient breathing muscle, and it's the one that does the bulk of the work most of the time. But it's also the one that becomes almost inhibited. It doesn't work as well when we get very anxious, and when we have a lot of symptoms, we do tend to breathe up in the chest. And so learning how to breathe down into your belly during exercise, but even at rest, can have a big impact on your overall exercise efficiency as well as your symptoms. Another one is what we call resonant breathing, and this is one that is a slow, deep breathing pattern that people will use, where you're breathing in at approximately 6 breaths a minute. And this is based on the work that we understand about what we call our autonomic nervous system. And this is our autonomic nervous system is, if you've heard of the fight or flight response, that's our sympathetic nervous system. And then the opposite of that is the rest and digest. That's our parasympathetic system. And what resonant breathing, or breathing at about 6 breaths a minute, will do is it will give you the opportunity to try and tap into strengthening our rest and digest response, and be able to come out of this heightened state in this fight and flight response, where our breathing rate is really high, our heart rate is really high, and we're in a very anxious state. If we can learn to take these slower, deeper breaths, they can have a better impact on accessing our parasympathetic system, or our what you might have heard called the vagal system, or the vagus nerve, and really trying to get people to learn how to rest and get into that rest and digest, and almost like calm their nervous system down. And so this type of breathing has actually been studied in individuals with asthma, and has been shown to really do this. It's been shown to increase our parasympathetic, or our rest and digest response, and help the overall ability of our cardiovascular system to do its job and to do what it really needs to do more efficiently with less symptoms. The last bit that I'm going to talk about is pursed lip breathing. Is another way that is been around for a very long period of time to look at trying to slow your breathing down. So it's another method that has been shown to reduce symptoms, particularly your symptoms of shortness of breath during exercise, also sometimes at rest. And it really just involves just pursing your lips like you're going to give a kiss, not pushing your breath out, but just as you're breathing out, to and just do a nice easy breath on the way out. So these are all strategies that have been shown to reduce both the psychological symptoms and the anxiety associated with any asthma or asthma attacks that you may have, but also to reduce the shortness of breath that you might have because of an attack or during exercise. Another breathing method that I really enjoy personally that has also been shown to do this is the 4-7-8 method, and this is really just where you time your breathing to try and make your expiration or your breathing out really long, and this will help do both help you with the mindfulness aspect as well as the resonant breathing aspect. It's sort of around the same concept of trying to get you to relax and to try and reduce your symptoms either during attack or during exercise. And so it's just a nice easy 4 count to breathe in, a hold for a 7 count, and then a breath out for an 8 count. And so what you'll notice if you're doing this is that's a lot of holding and breathing out. And so this breath in, that 4 seconds in, usually has to be a very fast breath in, and then it's a nice hold and then a really nice slow breath out. And again, that can help with your symptoms and of shortness of breath during exercise. To remember though, and this is, I did mention this, but I want to really highlight this, that there have been studies that have looked at the improvements of asthma control with things like exercise or with breathing exercises. And so in this particular study, they looked at the difference between those, and they found that with about half the individuals assigned to an endurance or aerobic or just a physical activity exercise program maintained their improvements after a long period of time, after 3 months of treatment, and only 20% maintained their control with breathing exercises. And so they looked at these individuals as individual types of exercise or types of interventions. But if you combine them together, as well as keeping your symptoms under control through proper medication and other methods of preventing attacks, this is where the biggest benefit can happen. So overall, my recommendation is get your asthma symptoms under control, be as active as you can, and probably add some breathing exercises in to help with your symptoms. Now, the very last type of exercise that I want to talk about is strength training. And very surprisingly, actually, we know that this isn't surprising, we know there's a lot of benefits to strength training, but surprisingly, it hasn't been demonstrated as much in individuals with asthma. And there hasn't been a lot of research that has looked at strength training or resistance training in individuals with asthma. But that certainly doesn't mean there isn't a benefit. And this is a study that I won't get into the details of what they did, but it's basically just a review that looked at resistance training on lots of different aspects of health and preventing chronic disease. So we know, and this infographic is basically from that review, but it's a really nice view of showing some of the benefits that happen with resistance training. So even if these benefits don't necessarily directly impact asthma or asthma control, we don't know whether they do or don't, because again, it hasn't really been studied very well. We know that there's a whole host of other benefits that can help you with your overall function and your overall quality of life, improving your blood lipids, your blood pressure, your glucose and insulin sensitivity, all of these aspects that are related to cardiovascular health, as well as just the muscle mass and strength increases. So we do see a ton of benefits associated with resistance training. So I usually, when I'm talking to individuals about their overall physical activity, I usually recommend doing your physical activity recommendation 3 to 5 times a week, and also have at least 2 to 3 times a week that you're involved with some muscle strengthening type activities. And after this presentation, if you have questions about what that could look like, I can definitely provide some examples of what you could be doing, or how to get started on that aspect as well as part of the discussion in the question and answer period. All right, so in summary, I'm going to make this very, very simple. Get control of your asthma symptoms. That is the first and most important aspect, is seek an appropriate healthcare provider that can help you, that has expertise in asthma and can help you with gaining and maintaining control of your asthma symptoms. And then finally get moving. And there really, if you look at the evidence, and I did touch on this a bit, there really isn't evidence to support one style of exercise over another style, or the type or the intensity or the duration, or all of these aspects that we can think about are have all been shown to be beneficial, as long as you're avoiding the triggers and as long as you're avoiding the aspects that can increase your particular symptoms. And so get as moving as best as you can, and working with a professional is a great way to try and sort some of these things out as to what might be the best way to exercise and what might not be. And so that's definitely something that I would recommend. As I mentioned, there's a couple resources. I will ask the kind folks at Lung SAS to have these resources available. Of course, they already do in terms of the Lung SAS one. This link at the bottom here is the one that is related to asthma, but they certainly have a lot of resources on here about all different types of lung conditions. But this the resources they have listed on this asthma page are very, very important and very good bits of information that I would highly encourage you to go to learn a little bit more, but then also to access some of the certified respiratory educators or the certified asthma educators that are available through the Lung Association. So thank you very much for your time and your attention, and this will end the formal part of my presentation. And after this, after a couple messages from Lung Sask, I think we can get straight into doing some question and answer and discussion. So thanks again.
Thank you so much, Dr. Butcher, for that wonderful presentation and providing such practical advice that's all evidence-based. And I just loved your summary. First gain control and then get moving, and very true. So thank you so much. And I just want to let everyone know that Dr. Butcher's presentation has been recorded and it will be posted on our website, lungsas.ca, under our patient education webinars in the Lung Life webinar series. So if you want to watch it again or share it with friends or family, you certainly can do that. And if you haven't already done so, and if you have a question, please go ahead and put it into our question feature on our webinar software, and we will try and get to your questions. So there's already a few, so I'll get going, Dr. Butcher. The first question we have is it okay for me to take my reliever or rescue inhaler, something like salbutamol, before I exercise?
Yes, absolutely. The short answer is yes. Having said that, as you reminded me actually right before this presentation, that the new guidelines on asthma management of mild and moderate symptoms are suggesting that if you're needing to take these rescue medications more than twice a week, that would really indicate that maybe your asthma isn't really under control to the level that it should be. And so while we do recommend that to be able to take it as a prophylactic or a pre-exercise measure to prevent symptoms, it probably also means that your asthma isn't really as well controlled as it possibly can be. There are exceptions to that exceptions to that in the situations where you might have a true exercise-induced bronchoconstriction, but that's something that you really need to talk with your healthcare provider about and have the proper type of tests to ensure that that's actually the case. Because as we said, number one, the biggest thing you need to do is have control, and that would an excessive use of your rescue inhalers means that you probably don't have enough control.
Great. Wonderful. Thank you. And yes, all very true. Okay, so here's another question. How would I know if I'm short of breath with exercise because of my asthma, or is it just because I'm unconditioned or out of shape?
Yeah, that's a really great question, and one that I really hear a lot. It's not really straightforward just looking at your symptoms, because as you rightly point out, being excessively short of breath or feeling lots of challenging sensations with exercise in your breathing could be an indication that you're simply deconditioned or you haven't been training well enough, or it could be because of your asthma. So again, the biggest thing to do is to talk to a healthcare provider to really help them help you in determining which is the case. Now, I did bring up some examples during the presentation where we can actually do formalized testing, exercise testing, where we would actually measure your breathing flow rates and volume rates and do flow volume loops during exercise, and have a look at those patterns of breathing that I showed you, and determine if that's actually the case. Because if you are simply out of shape and it isn't really due to your asthma, you won't see those mechanical constraints and that expiratory flow limitation leading to that hyperinflation. You wouldn't see that as much. You might see some combination there, but it really helps the exercise professional, as well as your respiratory physician and respiratory healthcare professional, understand how limited that asthma is, or is it because of some of these other factors. So talk to your healthcare provider, and if it's an appropriate, arrange one of those tests through the health regions to actually have that formal testing done. That's the most concrete way of looking at it.
Perfect. Thank you. Great answer. Okay, so this individual is asking, how do you help or counsel people that are okay doing mild to moderate exercise with their asthma, but then when they go to more of the higher intensity exercises, maybe something like HIIT or longer endurance and more competitive, they're finding that they're symptomatic. What would you do in that scenario?
Yeah, it gets tough because while I mentioned that really any type of exercise can have benefits, we also know that almost any type of exercise can cause symptoms as well. And so it really is about finding the right balance for you. And there's no short answer to saying what's the right way to approach it, because if you're someone who really enjoys those activities, I don't want to be the one to tell you you shouldn't do that. But what I will say is that is a situation where, again, what you're seeing is a lack of control of your symptoms appropriately for that type of exercise. So what you might need to do, there's sort of two things. One would be maybe temporarily change what you're doing so that you don't get those symptoms. And again, that doesn't have to be a forever thing. I don't want you, if you're an endurance athlete and you love to run, a half marathon, and that's giving you problems, I don't want to ever say that that's not ever going to be the case, that you'll be able to do that again. But what you do need to do is maybe take a break from doing that style and get your symptoms under control again. So again, it's going back to your healthcare provider, regain control. And the same thing in the opposite direction. We find that often individuals who have difficulty with the longer duration style exercise do really well with high intensity interval exercise or CrossFit style exercise, and they don't get as many symptoms with that. And so it really, again, just depends on your circumstances. But the take home message is they stay the same. My two messages: first of all, make sure that you do have control of your symptoms, and if you don't, continue down the path of finding the right way to gain as best control as you can, but then also find ways to get moving. And even if it's not what you want temporarily, at least try something else and see if you can have some better success with your physical activity, at least until you can get your symptoms under control to go back to that type of activity.
Perfect. Thank you. That was great advice. Okay, so this individual has been relatively newly diagnosed with asthma. Um, they are controlled within control guidelines. Haven't been very active for a while, and would like to start to become active, but nervous about losing that control again, just because they're newly diagnosed with asthma. What would you recommend for them? Would you recommend them going to see a physiotherapist, starting in a pulmonary rehab program to start? What would you recommend?
That's a great question. It honestly, it depends, associated with this one as well. It does depend on your overall comfort level with exercise and activity. I fully understand the anxiety and the nervousness that would happen in those situations. We do know that for many people, light intensity activity of any sort that is something that's enjoyable tends to be not the safest from a injury risk or a cardiovascular risk perspective, but it tends to be the exercise that we would highly recommend for almost everybody. And you might need to start off with just to take it nice and slow and easy, and maybe, you know, even though my guidelines suggested 20 to 30 minutes, 3 to 5 times a week, it could be a lot less than that to begin with. Or you could even break up your bouts of exercise into smaller chunks. Rather than going 20 minutes, you could go maybe twice a day for 10 minutes, and just keep it nice and easy, keep it pleasant, like Dr. Hyde suggested for us back in 1882, is keep it pleasant until you know, it's pleasanter to do something else, and give that a try. Now, that would be my first bet if you were feeling like you could try and manage this on your own. If that isn't the case, if you start that and you find, well, you know, I'm not able to push to the level that I want, or I still have questions and concerns, then absolutely, Jill's two suggestions there of seeing a physical therapist or an exercise therapist that has experience with asthma, or even into a pulmonary rehabilitation program could be good places for you to go, where these individuals can really help you work through how to exercise and try and keep those symptoms under control to the best of your ability. And I wish you lots of luck with that, because it's you know, the first step is really the desire to get out there and want to do it, but you don't have to do it alone. You can try it on your own if you want, but there are lots of people out there that can give you guidance and help you out.
Perfect. Thank you. The great advice, and lots of options, right? Because everyone's different. So that's great. And I will also mention there's a list of pulmonary rehab programs in Saskatchewan on lungsas.ca's website if anyone's interested in finding those. And we do try and update them as the programs are updated. I know several of the programs are starting back up after being, having a pause with the pandemic. So that's great news as well. Okay, so I think that is all the questions we have tonight. And I just want to thank you, Dr. Butcher, for wonderful presentation, but also your great answers to these great questions. We just really appreciate your time and your knowledge and spending the evening with us. We're really grateful.
Well,
And I also
I'm very grateful for you as well, Jill. Sorry to interrupt you there. I'm very grateful for you and for Lung Sask and the relationships that I've built and the good work that you guys are doing. And I'm very happy to support that in any way I can. So thank you as well.
Well, I'm sure we'll have you again. We really do. It's so great to have someone that has a passion for lung health, passion for exercise, but also such a great passion for teaching and research. So that's great, and that really supports our Lung Saskatchewan mission. So thank you. And
You're
I
welcome.
also want to thank the great people at GSK, our wonderful sponsors tonight. Thank you for all that you do to help people feel better and live better, and for everyone that joined tonight. And so if you would like, we hope that those of you that joined tonight, that you'll join us in our next Lung Life webinar series. Our next one is actually on May 10th at 7 p.m. Central Standard Time, and it's the Ask the Experts Is Your Time to Quit panel discussion. And then we also have another asthma related webinar on September 8th about asthma control and avoiding the September spike. So we hope that you'll join us then. Again, remember, this webinar will be posted on our Lung Saskatchewan website, lungsas.ca. And that is all the time we have tonight. And thank you all. Stay well, stay safe, and gain control and get moving. Have a good night.
Bye, everyone.
Bye.